It's a great honor to be invited to such an esteemed event. In this presentation, I'll go through the timeline to reveal the decentralization trend in drug testing confirmatory techniques. I'm Ghadeer Abdelaal, Forensic Medicine and Toxicology Senior Lecturer at Faculty of Medicine, 𝐏𝐥𝐸 University, Fellow of the Egyptian Forensic Medicine Authority in Cairo, and founding member of 𝐏𝐥𝐸 Forensic and Clinical Toxicology Research Laboratory. Scientists have been long thinking, what if we could bring the central lab confirmatory drug testing techniques to crime scene to give fast, accurate, real-time results without alteration of the evidence. In recent years, this dream has come true. MS. One could go back 120 years when it was largely confined to the fundamental studies like physics and physical chemistry. However, as we are focused today on analytical mass spectrometer, let's consider just the past 70 years. In 1958, the earliest gas chromatography mass spectrometer was assembled. Then, the computerized quadrupole 𝐺CMS was commercialized in 1968. 𝐺CMS is considered the traditional confirmatory gold standard for drug testing. However, it is limited to volatile nonpolar compounds. Then, with the progress in the ionization techniques, liquid chromatography mass spectrometer has emerged in 1987 based on thermospray ionization, and in 1990 based on atmospheric pressure chemical ionization and electrospray ionization. The coupling of liquid chromatography to mass spectrometer opened the door for analysis of thermally labile and involatile compounds. Quadrupole mass spectrometer is considered as low-resolution mass spectrometer with accuracy of 1 atomic mass unit. In other words, if we have two different compounds having the same molecular mass, they will appear as one peak in the MS and cannot be differentiated. To be able to differentiate the two compounds, they must have at least 1 atomic mass difference to appear as separate peaks. This leads me directly to the high-resolution mass spectrometer in 1996, which was commercialized by VG Micromass, which now known as Waters. The high-resolution mass spectrometer is a hybrid between the liquid chromatography tandem mass spectrometer and time-of-flight mass spectrometer, in which the time-of-flight tube replaces the third quadrupole in the triple quadrupole mass spectrometer, providing higher resolution of about 0.001 atomic mass unit. Thus, the high-resolution mass spectrometer can identify isomeric compounds. High-resolution mass spectrometer has drawn great interest among forensic toxicologists to advance the non-targeted comprehensive approach for illicit drugs, including new psychoactive substances. In 2004, a major breakthrough in the ionization techniques occurred with the development of ambient ionization. DESI, or desorption electrospray ionization, was reported as the first ambient ionization technique, and since then more than 40 methods of ambient ionization have been described. DESI is an electrospray ionization related technique where direct desorption ionization takes place. In DESI mass spectrometer, charged solid particles impact the surface of the specimen under native conditions, causing both extraction and ionization of the analytes. It is used for analysis in the solid phase. However, a liquid specimen can also be analyzed if a dried spot is prepared on a solid material. DESI can produce an image based on specific ion. For example, illicit drugs, explosives, agrochemical substances that is present in sufficient amounts by recording data at different locations within latent fingerprint. This chemical signature provides information about the identity and recent activity of the individual. Moreover, overlapped prints can be distinguished. In this figure, DESI image of cocaine distribution on a latent fingerprint blotted on glass in figure A, and in figure B, the computer-developed fingerprint from DESI image. And the red dots represent the minutiae that we can identify the person from. Then, in 2005, came the direct analysis in real time, or DART. Although the development of DART actually predated the DESI development, the initial DART publication didn't appear until shortly after that of DESI, and both are considered as pioneer ambient ionization techniques, which do not require any prior sample preparation. In contrast to the liquid spray used by DESI, the ionizing gas from the DART ion source contains a dry stream with excited state species such as helium, argon, or nitrogen that ionize atmospheric molecules. DART allows fast, non-destructive analysis and can be used for the analysis of solid, liquid, and gaseous samples in their native state. In this photo, a capsule is held in the sample chamber between the DART ion source on the right and the spectrometer inlet, which is a cone on the left. After that, in 2006, ion mobility spectrometer has emerged. After that, the one using a classic drift tube, also on a quadruple time of flight, was offered by Agilent in 2014. Ions are separated in the ion mobility spectrometer based on their speed through the carrier gas. It depends on three molecular characteristics, which are charge, mass, and the collision cross-section, in contrast to the conventional mass spectrometer, which only depends on the mass-to-charge ratio. Thus, it can structurally characterize isomers, and it can detect 1 part per billion. Currently, portable devices have been developed mainly based on a miniaturized platforms of mass spectrometers and spectroscopies. Here we are going to focus on the pros and cons of each current portable device used for on-site drug testing. Let's begin with miniature ambient ionization mass spectrometer. Well, it gives both qualitative and quantitative data and use unprepared samples, so it's non-destructive technique. In addition, portable devices are available and gives easy and rapid results. However, the alteration in the environmental conditions and its low reproducibility if repeated, and the strong matrix effect which can affect the ionization of ions and hence the detection, all these are disadvantages, in addition to the difficulties in identification of isomers, and it is more expensive than other alternatives. The second portable device is a handheld ion mobility spectrometer. It can distinguish isomers and gives both qualitative and quantitative data, use unprepared samples, and portable devices as well are available, gives very rapid results within seconds, and requires little maintenance and low costs for consumables. Its disadvantage is about its drift tube, that it has a limited resolution for a given fixed length. Our next advance is a handheld Raman spectrometer. In Also, it gives both qualitative, quantitative data. Unprepared samples are used, but here it can analyze samples within their packages, and it's present in affordable costs. But it has a drawback, which is a low sensitivity due to weak Raman signals or the strong fluorescence by the impurities or the colored packaging. Finally, the handheld near-infrared spectrometer both gives qualitative and quantitative data, and in addition to geolocation information, if coupled with a mobile application, non-destructive as it uses unprepared samples, well, it can also analyze samples inside their packages, and portable devices are available, gives the results within seconds to minutes, and it's present in affordable. It's available in affordable costs. However, it's unable to detect illicit drugs in trace amounts and unable to detect new psychoactive substances. Here, I'd like to finish by highlighting the recent promising devices under research, such as the electrochemical sensors using the screen-printed electrodes, which has many advantages as they are portable, rapid results, easy to use, uses low amounts of reagents, can detect a new psychoactive substance, and very sensitive. However, shelf life is a drawback. It depends on storage conditions to keep the integrity of biomolecules for selective detection. The second advance is a lab-on-chip, which uses a microfluidic system. It has many advantages. They are portable, easy, gives rapid results, uses low amounts of reagents, in addition to multiplex detection. However, they have lower sensitivity and selectivity than other alternatives. In conclusion, the drawbacks of central laboratory confirmatory techniques, such as the need for extensive sample preparation, time required for separation, the destructive nature of the analysis, in addition to the use of relatively large equipment, made researchers work through the last decade on developing various non-targeted, sensitive, and on-site portable devices for fast drug testing at points of care and street levels. I'd like to finish with a take-home message. Science is cumulative. A current research builds on previous ones. Advances in one scientific area lead to progress in many other fields. Finally, the ultimate goal of scientific research should always be human welfare and peace. Thank you. If you have any questions, I'd be glad to answer them now. And feel free to contact me on my email, ghadeer.mma@gmail.com.
Thank you very much, Dr. Abdelaal. Are there any questions from the audience? I can pose a question for you. I'm wondering to what extent do you see adoption in Egypt of these techniques? And you're talking to an audience that is mostly pharmaceutical manufacturing centered, specifically that area.
Yes, well, as I'm working in the forensic field, we have in the forensic authority in Cairo, the main center, a high-resolution mass spectrometer. But as a portable device, it will concern more the police agencies and the criminal labs. But as a central labs, we have the high-resolution mass spectrometer.
Thank you very much. We appreciate your time. Thank you very much.